Hi, I'm Dr. Ludo Gallego of Northwest Face and Body, and I want to discuss sizing for breast augmentation surgery. This is probably the one topic that gives patients the most anxiety when they see me in consultation, as to being fearful, of course, not to be too excessive in their choice of implants, but also, wanting to have enough enhancement to achieve the desired goals. And how is this really done? One of the problems is that traditional sizing in many physicians' offices has been with literally taking breast implants and placing them within a bra, and then looking in a mirror and saying, does this look too big or too small? Is this about right? The problem with this technique is that it is unfortunately not very accurate, and individuals tend to probably underestimate what the sizing would actually be. So this is something where if you query a patient having had breast augmentation and ask them, if you had to do it again, would you have been bigger or smaller? In many cases, patients would say, well, I probably would have chosen a somewhat larger size. And that's because I think that there's an overestimation of sizing by simply placing something in a sports bra and then looking in a mirror. Other techniques, such as using rice in baggies or water in baggies, again, suffers a similar type of problem. And also, you cannot certainly rely upon looking at images on the internet of someone who had such and such a size implant. That implant may be radically different in its appearance in you as an individual. So it's obviously a very customized scenario. We have the luxury of having some of the most sophisticated 3D imaging technology in the world. This is called the Vectra XT. It's from Canfield Industries, and it's equipment that basically is able to take a three-dimensional image of you as an individual, and in real time, we are then able to place a given implant literally by model number and brand profile, etc., so that you can see what does it really look like. And this gives us probably the most accurate simulation of reality that we have. Literally, we scan an individual, then sit at a computer screen and say, okay, we're going to try a 350cc implant. This is what it looks like. You can then look at it and say, this looks right, it's too big or too small. We can fine-tune this to a great extent. We can also work with different profiles of implants, meaning the relationship between the diameter and the height, which changes projection versus the width of an implant that has an effect upon issues such as cleavage and projection. And these are all factors that we can actually look at directly. And with this, we're able to provide our patients with a very customized understanding and selection of what the right implant would be. I feel that utilizing this kind of technology really affords our patients the ability to see and to have some predictability as to what their outcomes would be. And I think this relieves a lot of anxiety in the procedure. So we hope to see you for your imaging session.